Hello, my name is Israel Estrada. I'm with the Oregon Health Insurance Marketplace. I'm going to be going over some of the health insurance options that are going to be available to you both as displaced workers and then just generally as Oregonians. So the first thing I'm going to mention is something called COBRA coverage. And COBRA is just a continuation of whatever existing health coverage your employer already offers. Some important things to remember regarding COBRA coverage is that without the employer helping you pay for it, it can be very expensive, but it is something that is available for you if you choose to use it. And if you do, it's the same coverage you currently have. That means the same doctor networks, the same providers, same cost for all your services. Main difference is that you are paying 100% of the cost after that point. If you decide to enroll into the COBRA coverage, you have a 60-day window to decide whether you want to get it or not. And what that means is from your last day of regular coverage, you have 60 days to decide whether you want to do the COBRA coverage or not. If you wait beyond that period, you will not be able to enroll into COBRA coverage. You'll have to choose one of the other options that's available for you. So just to remember the key points regarding COBRA coverage, it's the same coverage you have now. You're paying the full cost yourself in most cases. And if you want it, you only have 60 days to do the actual enrollment into that coverage. For those of you that choose not to do the COBRA coverage, another option that will be available for you is healthcare.gov or through the marketplace. That's who I represent. What's nice about healthcare.gov is that it's a one-stop shop where you can apply for financial assistance, shop for coverage, and enroll into coverage all in one place. There's two different forms of financial assistance available through the marketplace. The first is something called tax credits. And what that means is when you apply, you'll be determined eligible for an amount of tax credits based off your income. And typically the way it's structured is that the less you're making, the more help you're going to get. And those tax credits can be used to lower the monthly cost of whatever coverage you decide to purchase. Or if you choose to, you can delay all that tax credit till the end of the year when you file your taxes. So just as a simple example for you, let's say you did the application, you qualified for $300 worth of tax credits. Then whatever plan that you purchase on healthcare.gov, you could lower that monthly premium by up to $300 a month, or choose to add that to your tax credit when you file your taxes at the end of the year. Most of you will take that every month, but that option is available for you to do it at the end of the year if you choose to. There's a second form of financial assistance available through the marketplace, and that's something called cost sharing reductions. And what that is even when you have health insurance, typically when you go to the doctor or you pick up a prescription, you still have to pay something on top of just having the insurance. So for example, it's a $20 copay to go visit the doctor, or it's $15 to pick up your prescription. For those of you that qualify for the cost sharing reductions, it will lower the monthly, or it will lower the cost that you pay whenever you actually utilize your services. So for example, that $20 office visit becomes a $5 office visit. That $15 prescription becomes a $3 prescription. Anytime you are paying something out of pocket for anything besides the premium, it will lower the amount based off the amount of cost sharing reductions that you get. There's a second way that it helps people out, and that has to do with something called a maximum out of pocket. So for most adults, that max out of pocket is about $7,000 for a year. And what that means is every time you are making one of those payments out of pocket for anything except for the premium, insurance companies keeping track of how much you spend throughout the year. And once you've spent an amount equal to your max out of pocket, the insurance company pays 100% for any covered service after that for the rest of the year. Doesn't matter what that service is, if it's covered, you pay nothing out of pocket. So if you need a major surgery, a kidney transplant, if you have met your out-of-pocket cost for the year, insurance company will pay that 100% for the rest of the year. Remember, for most adults, that's about $7,000 for a year. But if you qualify for the cost sharing reductions, that max out of pocket can be reduced to about $1,000 if you get the maximum level of benefit. And that can be a pretty significant savings. And if you are in a household with somebody that has a chronic condition that goes to the doctor quite a bit, you can reach that max out of pocket cap very early in the year. And then the rest of the year, you're only paying your monthly premium, which you are also getting help with. So things to remember about the marketplace: financial assistance is available. You can apply for financial assistance, shop, and enroll all at the same time. And then one of the most important things Unless you're in the annual open enrollment period, which is November 1st through December 15th, you're only allowed to buy or change plans during certain times of the year when you have what's called a qualifying life event. Most of you will have that because one of the qualifying life events is, did I lose coverage within the last 60 days? And if you have coverage through your employer and that coverage is going away, that will give you an opportunity to shop. So remember that if you want to enroll, you either have to be in that during that open enrollment period or within 60 days of losing your employer-sponsored coverage. And if you know it's going to end, I would highly recommend that you take action before the coverage actually runs out. That way you don't have a gap in that coverage. One thing I do want to remind you about, if you have a spouse that is working, that special enrollment period that you have to enroll in either the marketplace can also be used to enroll into that spouse's coverage. So that is something to keep in mind. Another thing to keep in mind is that depending on the circumstances regarding that spouse's coverage, it could prevent you from receiving financial assistance from the marketplace. If you're not sure about that, that is one of the good questions to reach out to us about so that we can go over with you to see what your actual options are and help you try and decide which one's going to be the better option for you. Going with your spouse's coverage or checking with the marketplace to see if that might be more effective for you. The key thing is we want you to think about these things before you actually make a decision because we want you to make the right decision while you have the time. Next thing I want to mention is the Oregon Health Plan. Oregon Health Plan is a state version of Medicaid. It is a need-based program, and the need is based primarily on your income. Your income has to be below a certain level in order to qualify. For most adults, it's about 138% of the federal poverty level. And if you want an example of what that would be, you should have this in your packet in front of you. It should be a yellow and black document. And on the left-hand side is how much you can make as an adult to qualify for the Oregon Health Plan. And I will admit, it's not very high. Like I said, it's 138% of the federal poverty level. But what I always like to point out to families, that second column from the right, and that's how much your family can make and have your children covered under the Oregon Health Plan. That amount is significantly higher. It's almost 3 times what an adult can make. So I always like to say that it may not be the sole answer for you, but if you can get your kids covered under the Oregon Health Plan, any money you save from them, you can apply towards the rest of the household. And what's really nice about OHP, the Oregon Health Plan, zero cost coverage, no out-of-pocket costs for covered services. So anything involving OHP is zero cost if you are utilizing that program. So remember that if you can get your kids covered, that's more money you save. That means there's more money available for the adults in the household to try and find something for themselves. Another nice thing about the Oregon Health Plan is that unlike the other types of things, there's no time limits, there's no period that you have to enroll. If you apply and your income says you qualify or you qualify for any other reason, you get that coverage immediately. There's no waiting period. You don't have to wait till a certain time of the year. So remember, the Oregon Health Plan, you can apply at any time of the year. Eligibility is determined based off income, and children have a higher income threshold to qualify. And finally, the last thing I'm going to mention is Medicare. I don't know how many of you this will apply to, but we always like to mention it because when it comes to Medicare, you're not given a whole lot of guidance. You turn 65, the feds send you a 200-page book called Medicare and You, and it's kind of up to you to figure out what to do with it, what to do with all that information. And there's a lot to know. You got your Medicare Part A, which is your hospitalization. You got your Medicare Part B, which is your doctor visits, your examinations, your testing. Then do you want prescription coverage? Well, that's Part D. Or you can bundle them all together, and that's Part C, a Medicare Advantage plan. Or maybe you just want to go with a Medigap policy, a supplemental plan. If you're confused by those terms, so am I. It's a lot to go through, and I've been doing this for quite a while. If you need help with that, or even if you don't, maybe you have a parent or grandparent that needs help with their Medicare counseling. Our agency does Medicare counseling. We're more than happy to walk you through the process, whether it's enrollment, choosing a plan, trying to figure out what you need to do. Feel free to reach out to us. The Medicare counseling we do is available to any Oregonian. So this doesn't have to be specifically towards you. So if you have a friend, parent, relative that needs help, by all means, send them our way. Because it's very important that when you turn 65, that you do not make a mistake on your Medicare. Because if you make a mistake, let's say you don't enroll when you're supposed to, or you only pick up one of the parts and you need the other part a little bit later, you could pay a financial penalty for the rest of your life. And usually when you are Medicare age, your income's not as high as it used to be. So any penalty can be very, very prohibitive for you if it applies to you. So remember that. When it comes to Medicare, please don't make a mistake. Get the help you need. Come to the marketplace. Reach out for our Medicare counseling. I'm going to point out this other document that you should have received in your package. And what this is, it's just a summary of everything that we discussed. So if you want information about COBRA coverage, there's a summary about COBRA coverage right there. If you want information about the Oregon Health Plan information is right there, as well as their direct contact number. So if you know that you need to talk to OHP, number's right there. If you want to get our Medicare counseling, go to the Medicare section on here. Or if you want to talk to myself or someone at my agency, go to the healthcare.gov section down here at the bottom. What's really important with this presentation is that you don't necessarily have to remember every single thing that we discussed, but we do want you to remember where you can go to get the help and answers that you need. So what's really nice about my agency is if you don't know where to start, or maybe you have a household in a mixed situation where maybe you have your parents living with you, you have a couple kids. Well, a household like that, maybe the kids qualify for OHP, parents and grandparents need help with the Medicare, and then the rest of you are looking for coverage for yourself. Our agency knows enough about all the programs that we can guide you through that process, and then if necessary, we'll help you as much as we can, and then we'll hand you off to the next agency so that they can help you with their portion of the process. So please remember, if you need any help, have any questions regarding any form of healthcare in the state of Oregon, please check with the Oregon Health Insurance Marketplace. Contact information is all this. It's on all that yellow branded materials that you're seeing right here. And please feel free to either call us or reach out to me if you have any questions.